Hello, my name is Emmanuel Diodu, the president of Ghanaian-Canadian Association of Ontario, alias Ghana Union. Today, I just want to um, connect with the community, and the connection today is about the health of our community. So, we want to declare July as Health Awareness Week for our community. What does imply that we want to make sure that all the little things we can do, about our health are all taken care of. I think one of the most important things we can do for ourselves, for our family, and for the community is to schedule a medical checkup, the annual checkup. If you've done it, great. But if you haven't done it, may you talk to your physician or your medical person, the one who you normally work with, to make sure that you can schedule that. And also there are other things too we can all do. The month of July, even if you do walk more, or if you have to cut down on certain things when it comes to food that are saturated in anything that is not good for you, may you do that. I'm not a doctor, but I'm speaking from a point of view of a layman. But I know that the things I've spoken about, the medical checkup, your diet, and some of the things we do are very, important for our health. I want to turn it into tree for a little bit. With the minimum Ghana for, with the duty in Musonfo, with the Ghana Union president, and then I'm per se. Mede to manim sɛ July ebe a bosome nsum na yɛpɛ sɛ declare ne sɛ Health Awareness Week saa month no saa bosome no sɛ adeɛ bi a wonkɔ hu doctor wonyɛ medical checkup annual one no a ɛyɛ afi biara yɛ no mɛsrɛ sɛ wobɛhu doctor ɛna secondly nnuane bi wɔ hɔ a yɛdi a ebia na ɛmma yɛ apɔmuden sɛ wobɛhwɛ so no wayɔ a wobɛte so kakra na wobɛtwa so a ɛyɛ ɛno nso yɛ nti wei deɛ me nua mu Ghanafoɔ nti saa July ɛyɛ adeɛ bi a yɛadeclare ne sɛ Health Awareness Month a yɛpɔmuden sɛ bɛtumi ayɛ ama wɔnyɛ apɔmuden ɛne hia ɛma yɛn nti Ghana Union yɛ message no nti mɛsrɛ mobɛte nneɛma pii yɛ doctors ɛne yɛ nurses nso bɛkasa ɛwɔ video nso so why yɛwɔ neɛ meda mo ase pii ɛneɛ onyame ɛnka mo bye bye.
Fellow Ghanaians, my name is Isaac Odame, Hematology Section Head at the Hospital for Children and Director of Hematology, University of Toronto. I'm delighted that GCAO has dedicated July as Health Promotion Month. As some of you may know, the United Nations in its Sustainable Development Goals has targeted that by 2030, the world should reduce by 1/3 premature death from non-communicable diseases through prevention and treatment, and to promote mental health and well-being. In the Ghana community, I think we can even set a higher target that by 2030, we'll reduce premature death from these non-communicable diseases by half. What are these diseases? 1, cardiovascular diseases, including high blood pressure and coronary artery diseases. 2nd, cancer. 3rd, chronic respiratory illnesses. 4th, diabetes. And 5th, mental health. One way in which we can do this is that each one of us should commit to see our family doctor at least once a year for screening and for possible treatment. Because we have access to healthcare in Canada, we should all take advantage of going to see our family doctors so that we can be screened for some of these non-communicable diseases, because they can be prevented and they can be treated effectively. So let's make it a goal that henceforth, at least once a year, a family doctor sees us, screens us from any of these diseases, and can put in place effective treatments very early to prevent premature mortality. Let's heed this advice so that we can live longer and serve our community better. Thank you for listening.
Hi everyone, it's Juliet Opoku. I'm the Vice President of the Ghanaian-Canadian Association of Ontario, and I'm here to talk to you about your health. We have chosen July to be the Health Awareness Month for the Ghanaians. The purpose of this is to us to raise awareness and for you to be in charge of your health. It's very important that you take care of yourself and you be in charge, take care of your family health so that you will be the one at the decision table when it comes to your health. What we want you to do is to make sure that every year, all we're asking is at least once a year you go in and get checked out from your doctor, right? Because that's the starting point. If you're going through any kind of mental health issues, if you're going through any physical health issue and you need to speak to someone, it starts with your family doctor or your nurse practitioners. You can go make an appointment to see them, and this way you'll be able to check your blood pressure. They'll be checking your blood, doing blood work to see where you're at in terms of your health. Because like as I always say, symptoms free doesn't mean health. So you could be feeling fine, you could be doing okay, but then there could be underlying illnesses that's happening that you may not be aware of. So going in and checking with your doctor and going for checkup is a good way for you to know where you're at in terms of your health. It's very, very important. Life happens, we all go through stressors, we go through a lot of things that can make us ill. Being in charge of your health means that knowing when you know to seek help. Right? We all need it at some point in our lives. If you are lucky and you're fine, that's okay. But at least once a year, you should go in and see your doctor to make sure that you are actually fine by doing your blood work, by taking medication as prescribed for you. All these are all ways of making sure that we're taking care of ourselves. Some of the lifestyle things that we can do, of course, you know me, exercising, going for walks with your kids, going for a walk with your family, eating a healthy, balanced diet. These are all ways of taking care of ourselves. So we have put together July as the month that we're going to do this to remind you to go in and check your health, check your family, to remind your family members to also get checked, because when we look after each other, that's how we thrive as a community. So thank you, and I hope that when we do in-person meetings, you'll be able to come in where we can check your blood pressure, we can check your blood sugar, and then kind of give you an idea what's happening with you. And if you have any questions, I'm there. Juliet, you can call me. There's other health clinicians. GCAO has a health wing that we're there to support you in any way. Once again, if you are going to any clinician and we need interpretation, please reach out to us. We can do our best to help you, because we want you to be able to communicate properly with your doctors to know what's happening with your health, right? Because sometimes people go and then they're not able to communicate properly, and that can lead to problems. So we want to make sure that we're here for you as a Ghanaian-Canadian Association to help you improve your health so we can all thrive together as a community. Thank you so much.
Hello, my name is Dr. Victor Awafo, Chairman of the Board of Advisors of GCAO. As part of GCAO declaring July as a health month, I would like to encourage all of us, in addition to hearing all the experts in the health field, to also be aware that vaccination is important. Check the vaccination status of you and your family, and make sure that you're updated with all the vaccines that you are needed. Thank you.
Ididi Aisha Kwesi Boati. We are one of the executive members of the Royal Ghanaian Nurses of Association of Canada. The association Eddie Yentama Abo Ghanaian-Canadian Association of Ontario Ayoko said ye omo declare Bosome July as Health Awareness Month, and also say Akumudin Ehia Asem. Nti we na epesi ebo ni de we de magana amanse nyina se umama ko mu hudin enye mu anya sakase checkups, monthly checkups, personal checkups, and then annual checkups. Eno ene betimi akwa ye nyina ebema ye afatenten ni akwate. Akose bo ne kana se Ɔsɛ prevention is better than cure. Ɛna early detection eliminate complications. Nti wei ɛna mede ɛbɛto so aka sɛ yɛma yɛapɔmuden ɛnyɛ ahiasɛm kɛseɛ ɛmfa ma yɛn nyinaa. I care, you care, Royal Canadian Nurses of Ontario care and Ghanaian-Canadian Association of Ontario care.
Good day. My name is Janet Brakunyapa, and I'm the founder and director of Safe Haven Cancer Support Society, a registered nonprofit in Ontario. The Ghanaian-Canadian Association of Ontario, also known as GCAO, has declared the month of July as a Community Health Awareness Month. Breast cancer and indeed many cancers affect many in our community. In Black women, breast cancer often presents in an aggressive manner. If detected in a timely manner, it can be treated early and in many cases even cured, leading to prolonged life. Safe Haven Cancer Support Society is in our community to offer culturally appropriate and sensitive emotional and spiritual support, encouragement, breast cancer resources, and education for those who have to go through this tough journey. We have in-person support meetings at 65 Mayo Avenue in Toronto, which is the GCAO hub. We also meet virtually by Zoom every other week. If you want more information about how we support our community, you can send us an email at safehavencs.01@gmail.com, or you can go to our website at www.safehavencss.org. I encourage every woman 40 years and up, or if you have a history of breast cancer in your family, to see their doctor, get referred to do a mammogram, go to a breast clinic in your area and get yourself checked out. Let's stay healthy and let's stay safe. And remember, early detection saves lives. God bless you.
Hi everyone, my name is Cynthia Amo. I'm one of the nurses from Royal Ghanaian Nursing Association. Forgive my voice. Today we're just here to talk about the importance of getting your annual physical checkup. It's very important that we all have a baseline medical health history. We know what our normal blood pressure is. We know if there's even something as little as a mole on our head or on our hand. We know that the doctor is aware and assessing it and monitoring it, because if there's any changes to any of your skin, if there's any mole on your skin, if there's any changes, they can detect it early. We know that if you know what your baseline blood pressure is, we know that, okay, if your pressure is 100, you know that that's normal for you. So just knowing your baseline for your medical health history is very critical, so that if there's any changes that are detected, they can act on it accordingly. It's only once a year. It's not that often. Once a year you check it, you go in, they do your checkup, they do blood work. If there's any tests that they need to do after, they do it, and that's it. And you're good for the entire year. In terms of ongoing, example, us women, we can do our breast self-examination ourselves every month. We can choose a day that we're familiar with, like maybe the end of our period, or maybe the first of every month, and just do the just going into the shower or standing in the mirror and just touch your breast just around here every month. Do it for both sides every month. Every month is very critical, because if any time breast cancer is detected, it started based on assessment that they did at home. And once you're able to see it early, the treatment can be started early, and the prognosis is quite good. So it's really important that we do that frequently. Men, getting your prostate checked, getting your rectal examination done. I know it's uncomfortable. Not men wants to talk about rectal exams. However, it's very important that we get it done, and we get it done routinely. So again, if there's any changes, the doctor can detect it right away and act on it right away. So let's all come together and make sure that we're, as much as we know about our body and our changes, we know what the inside looks like. We know what, if there's any changes, what to do and how to detect it. The doctor can detect it right away and act on it right away. Thank you.